Anxiolytic medications are medications that reduce anxiety, and they act by altering chemical synaptic transmission in the brain. The major classes of drugs currently used in the treatment of anxiety disorders are benzodiazepines and serotonin selective reuptake inhibitors, which I'll discuss in the next video. So first, I just want to recall that GABA is an important neurotransmitter, inhibitory neurotransmitter. So if glutamate is the primary excitatory neurotransmitter, GABA is the primary inhibitory neurotransmitter. So that's important, obviously, for panic disorders, right? Because when you're having a panic attack, you're having a lot of action going on in your brain. So you want to have something like this GABA receptor, which would bind this, which I'll discuss in a second, to inhibit these responses and inhibit the amount of action potentials that your brain is firing. As I've drawn down here, this is a GABA-gated chloride channel. So chloride obviously would cause the inside of the neuron to become more negative, and an action potential obviously occurs at a positive. So if I were to draw the action potential down here, it would look like something like this, where you have this peak, and then you have a little bit of an underdip, and then right there. So right here, you're not having a lot of chloride action, or chlorine action, you're having a lot of Na plus going in, sodium coming in, and then here you're having a lot of potassium coming in, and then here it's kind of reestablished its equilibrium, where the chloride ions are definitely in there. And if you were to have a big influx of chloride ions at the beginning of an action potential, so right now they were to come in, you kind of have an action potential like this, where it just wouldn't really reach its threshold, which let's say is right here, so there would be no action potential fired. So that is what chloride does. So if we're looking at this GABA receptors, GABA A receptors are GABA-gated chloride channels that mediate fast inhibitory postsynaptic potentials. So they inhibit the postsynaptic potential, and the proper action of this channel is crucial to the proper functioning of the brain. So if you have too much of this, then you'd kind of be in a comatose state. So there wouldn't really be much going on up there, and because everything that you're trying to think or do would just be inhibited constantly by this channel. And if there's too little, then you'd be having something like a panic attack. So what benzodiazepines do is they bind to one of these sites. So if we draw a site, let's do this in blue. So let's say that right here, we'll just draw it out here like this. And we'll draw another one right here, right there. And this channel right here is just where GABA, the neurotransmitter, can freely flow through. So this would just go right through and come through here. But what if you have a benzodiazepine which binds, and we'll do a little triangle shape, and it comes in here and it binds right there. So what it does is it binds to one of these sites, and it acts to make GABA more effective in opening the channel and producing inhibition. So why I've drawn this little receptor right here is because the other chemical that can do this is ethanol. So like your drinks, when you're going out to have a few beers or Cosmos, you will drink some alcohol, which will actually inhibit this so you have less anxiety. So that is why it's such a common drink to have when you are going out. Any drink that has ethanol in it, any alcoholic drink. It's so common to have that at social events because it reduces anxiety, and that's why you see people who maybe normally wouldn't talk to other people so freely and comfortably doing so. So that is why it is very common, because it is causing this inhibition, so you're not as nervous and you're not having any panic attacks, obviously. So that is why there are a lot of drugs like ethanol and benzodiazepines and serotonin or selective reuptake inhibitors. So benzodiazepine, an example of it would be something like Valium. So that's kind of probably the most well-known, or also known as diazepam. So these kind of drugs are really effective treatments for acute anxiety disorders. So virtually any drug that stimulates GABA actions are called anxiolytic drugs, which, as I discussed earlier, some include ethanol. In summary, you could say that the calming actions of taking a benzodiazepine are due to the suppression of the activity of the brain circuits that are used in the stress response, which I have a video on just before this. So the benzodiazepine would just inhibit those stress responses, which is why they have such a calming effect.